Without any further ado, I would like to welcome Dr. Evans Phillips for joining us. And thanks so much for making the time to be with us.
Thank you for having me. Absolutely. I'm so honored.
Well, it's sort of an informal thing. I'll probably just ask you a handful of questions. And then if anyone in the audience wants to chime in and ask a few questions, feel free, folks, to just put it in the chat or unmute yourself and interrupt us. Maybe some additional folks trickling in as we go, or else it'll just be us having sort of a fireside chat. But
Sounds good.
And I wanted to start off by asking you, just in general, how you found your way to pancreas. A lot of people ask, it's such a kind of a weird organ.
Yeah.
Did you always know you wanted to be a pancreas doctor?
That's a great question, and certainly something we hear a lot from patients. And so maybe I'll start out actually just by starting the response with where I'm at currently, and then start with where I came from, which is that, and I apologize if many of you know this already, but I'm currently assistant professor at the University of Pittsburgh, and I'm a medical pancreatologist by training and by current practice. Which means that in the end, I do a mix of medical pancreatology. I'm not a therapeutic endoscopist, but I do a lot of research, and then I also do some general gastroenterology to kind of round out my practice. Confession is that I was actually a medical student here. And so the direct answer to your question is that I found my way to the pancreas, quite honestly, just by good luck. When I was a medical student between my second and third years, at the University of Pittsburgh, there's a big emphasis on creating opportunities for research for medical students. And so at that point in time, there were several different programs and tracks. I applied to the Doris Duke Clinical Research Fellowship, which existed here at that point in time, and has I think since evolved. But I was introduced actually to Dr. David Whitcomb at that time, who has been a lifelong mentor then for me since that moment. And so this is back in 2008, I believe. Yeah, it would have been 2007, 2008 when I first met Dr. Whitcomb. And he was just very instrumental actually in showing me what research was about, in addition to specifically what the world of the pancreas was about. And so I started very fortunately in that setting, what was a very rich and varied and productive research group, which I only later came to realize was incredibly rare and very special. And so I was just very fortunate to start along this pathway at that point in time, at that location, and to move from there, eventually to where I am now. In some ways, it's been a kind of winding pathway, but there have been some crucial steps along the way. And I think at those crucial steps, with regard to the pancreas, it's an organ where there is a lot of work to be done. And so it's always been very exciting from that standpoint. It's wide open. There are so many things to discover, explore, make a mark in. I think the opportunities are truly endless. And so it's just a very exciting time to be working in this field. I think from an intellectual standpoint, the pancreas also really intrigued me. I did think briefly about going into transplant hepatology, but I think one of the discouraging things I found there was just that it's a very, in some ways, heavily surgical field at certain institutions. And so as I looked around at different opportunities and gave thought to what I would want my career to look like, I worried a little bit about what the opportunities would look like for me if I wasn't going to be a sort of heavy proceduralist. And I know that there are lots of wonderful opportunities in hepatology, but something then about pancreatology with the pretty heavy mix of intellectual input that's needed in order to diagnose and treat patients, and also that's needed to design and build and follow through on projects. That really was an opportunity that I found that I couldn't say no to. And so ever since, I've just been very lucky to be able to continue to have opportunities in this field.
Yeah, that's great. And when you, even as a med student, when you got involved with a great mentor, Dr. Whitcomb, even at that young age, you were already contributing to like big science, real science. Had a mentor who was publishing in big journals. And I imagine that was, although all pancreas research, I think, is sort of cutting edge because it's such a young field, particularly working with him, I imagine was invigorating for you as a student to say, like, we are really making a difference here in Pittsburgh. And I can imagine getting very engaged in pancreas research moving forward just from that experience.
Absolutely. I think some of the other things, looking back on it, some of the great things at that point in time were, again, just kind of the varied nature of the research group. And I had the luxury of seeing a number of different mentors. I'm incredibly indebted to George Papachristou, who, of course, is now at Ohio State, who was here at that point, and was working as a junior and then middle career level faculty member. And so I was able to watch that transition and how he, very artfully remained productive in so many different ways. And then Dheeraj Yadav, who's been another wonderful mentor, did so many different things, in epidemiology, and he really harnessed the capabilities of some of the big database projects that Dave Whitcomb had started. And so there were just a number of ongoing efforts at that time, and it was just remarkable to have the opportunity to see those varied efforts. And I really was lucky to benefit from them.
Yeah. And not to toot the horn too much of CAPER, but you came into the field of pancreas because you had good mentorship. That was me as well, meeting Phil Hart, and a number of the names you mentioned, Dave Whitcomb, George Papachristou, Dheeraj Yadav, they're all involved in CAPER program and sort of helped put it together and bring it to what it is today. So I think pancreas is a unique field in that a lot of the middle and senior investigators are like so committed to bringing up the next generation.
Absolutely.
I owe a lot of my success to that. It sounds like maybe you do as well.
Absolutely.
Through Whitcomb and all of them.
Mm-hmm.
Once you were in pancreas, I know you have a big grant related to pain, but what was it that got you involved in pain?
Well, I think that was one of the main things, where there were opportunities along the way. And here, in talking to trainees at all different levels, I think my unsolicited, advice is to keep eyes open for opportunities as they present themselves. I mentioned at one of the American Pancreatic Association meeting, pain is a difficult topic. When you see patients in clinic, it can be very uncomfortable to talk about. We really have very few good treatments for pain. Those that we do have either have side effects or significant downsides. And so it can be a very difficult thing to engage in with patients. And so I'll admit that I was a little hesitant, at the outset to think about this as a possible career avenue. But then in considering it further, this is really where the import is. Pain is the main thing that bothers patients, especially with chronic pancreatitis, where I do most of my work. And so I think trying to face that difficult situation head on, and recognize that we are starting from the very foundation, and making whatever strides we can in order to help patients. That's my mission as a physician and as a researcher. And so I think that helps to motivate things along the way.
Yeah.
Now here, what I would say in addition, is just that it was, again, very fortunate. Essentially, one of the opportunities that came along was through a series of mentors who have been working in new and innovative ways to assess and treat pain in pancreatitis. And so this has to do with evaluation of a previously unexplored aspect of pain, of chronic pain, that is, this phenomenon called central sensitization, where people develop very difficult and as of yet untreatable changes in their nervous system that results in perception of pain that is altered from what normal processing would look like. And so all that to say, that I owe the opportunity, I think, to mentors from all over the world, specifically a team from Denmark, who are quite notorious and accomplished and extremely prolific in their authorship, but Dr. Trues and Dr. Olesen from the University of Aalborg have been hugely important in my successes and in creating opportunities that have allowed me to build upon those things.
And so it's unique in that you've had some mentors at your institution that brought you into the field, and now you have these mentors abroad who aren't just down the street; they're
Yeah.
on the other side of the globe. So I guess, do you mind sharing with us a little bit about how you got connected and sort of what that mentoring relationship looks like? That may be different, for example, than what you had with Whitcomb or with Yadav, who are local
Sure,
mentors.
sure. Um, and here, I mean, it's anecdotal, and so I would say
Sure.
take from it what you will. Um, I was very fortunate to be introduced by Dr. Yadav to these researchers. I think they had a lot of ideas, but Denmark is a small country, and so they don't have a lot of patients on whom to work, who would enroll in studies. The size of the population that would be needed to evaluate some of these things. And so it was a connection made between somebody like myself who, was young at the time, and still very junior in a career, but who had, energy and interest and some ambition, in order to try and take on a project. And so it was a connection made from the outset, with an opportunity being presented, to try and take this on and build a program at the institution where I work that would be done in collaboration with their group. And that ended up working out. I would say, there were several things that really solidified, that connection along the way. One was that in addition to goodness, showing up, being responsive, asking questions when necessary, and trying, sometimes failing, and trying again. I took the opportunity to attend a conference. I went to the European Pancreas Club during the summer after that initial connection was made. And that was just very insightful to me, to be able to see them within a context that's more connected to what they do, and a group of people that's entirely different from the people I would normally interact with here. A whole new set of mentors and leaders and thought processes and bureaucratic processes. But it was just a very eye-opening experience, and one that also allowed me then to connect with them further, to see a little bit more about the other context surrounding some of this research and these ideas, meet some of their lab members and so forth. And that was very instrumental. And so there have been a number of invitations that have gone back and forth since then to include them in projects, to have them mentor things. And so that relationship has grown and brought more people into the fold, to the point of where, which you're aware, we have 13 centers in a consortium now, which has just been, a wonderful thing to be part of.
Yeah, and I've been involved in the QST consortium, which is the group that Anna's talking about, for a number of years, and I feel like the QST consortium and your leadership of it kind of came at a pivotal time in your career when you were going from fellow to faculty, and you were kind of striking off on your independent path from your local mentors who aren't as much pain people. How do you feel, or do you feel that having external mentors around the time where you launched as an independent investigator, you think that helped or made things easier, made things more challenging? What's your perspective on that?
It's tough to say. I think there are a few things that helped shaped my experience at that point in time. One was the pretty unique experience of actually staying at the same institution to make the transition from fellow to junior faculty member. For many people, oftentimes that's an opportunity to change institutions and can come with additional challenges where you're trying to learn a new institution and see what resources are available. And so for me, I didn't have the challenge of changing institutions, but rather of establishing myself as, in a new role at the same institution. And so, again, I think, I was very, very fortunate to have a lot of opportunities at that particular moment. For me, in looking outward, I think it was very instructive to have additional mentors elsewhere who were willing to talk very candidly and and respectfully, but also give me a sense of what the kind of range of opportunities and possibilities were. And so that was very helpful to me in a lot of ways. I think it also made me feel very grateful for the resources that I had available to me at the University of Pittsburgh. But also let me know that there were experiences that I should, consider and seek out outside of that, leadership and service opportunities in different organizations, attendance at different types of meetings, all different kinds of things. But I think their additional mentorship at that professional moment for me was just a wonderful relationship to start in that, in that space.
Yeah. And I like what you mentioned about sort of going to a new conference that's maybe
Hmm.
a different one than your mentors go to,
Hmm.
because it sounds so exotic to go to one, and then you get there and realize they think you're somewhat exotic too, because you have some skills and some experiences that they don't have.
Hmm.
And I don't know if it was you felt like a big fish in a smaller pond, whereas you go to DDW and it's so huge it's hard to even get a toehold. I don't know. Did you feel that way going to a new conference or somewhere where
Oh, that's a
you're
great question. Actually, very much a small fish. But
okay?
it was really a lot of fun. And I look back and at the moment, at that time, I was finishing a T32 fellowship here at the University of Pittsburgh, and then I was starting my non-ACGME medical pancreatology fellowship. And I applied as a fellow to go to there was an EPC fellows meeting right before that, where they had sort of a 2-day conference on scientific techniques. And at the time, and in my T32 fellowship, I was doing bench work on pancreas related things, actually some projects on fatty acid toxicity in severe acute pancreatitis. And I was super interested in it, and still remain interested in it. I, happened to pivot after that, but at that particular moment, I attended these techniques on different, laboratory activities. And oh my gosh, we went to Budapest and they were doing patch clamping, which
Oh,
like, takes a decade to learn from what I understand. And so, I spent my 4 hours in the patch clamp lab and, barely could manage, the tiny pipette. So it was very humbling,
yeah,
absolutely. But it was also just, very, welcoming. The laboratory researchers and managers and the other students were, very kind and open. And it was just such an amazing opportunity to step into these laboratories for a few days and get a sense of the intensity and the commitment of these folks who were doing this work. And so it was really, yeah, it was really just a wonderful experience. And I think it set the stage for understanding that I was really stepping into a different world of research. There was a whole different set of motivations and activities for people that sort of set mine into perspective.
yeah. And doing some bench work, I guess, and I'm sorry that I totally skipped over in your introduction
Oh, that's
going through
okay.
your CV.
That's all right.
But you do also have a master's degree. Is that right?
That's right. That's
And
right.
at what stage of training did you do that? And was that did you do some bench work as part of that also, or was it more
Wow.
clinical?
Great question. So, I did get a master's degree, and it happened in 2 stages. When I was part of the Doris Duke Clinical Research Fellowship, part of that opportunity actually was to obtain a certificate in clinical research. So, as the equivalent of a third-year medical student, was when I earned the first half of the credits toward that master's degree. Um, Now, I then went on to internal medicine residency, and I started Fellowship Columbia, where I applied to their Master's in Public Health program. And I was intending to do that there, but ended up transferring back to the University of Pittsburgh in order to pursue the T32 fellowship. And I was very lucky, actually, that the T32 allowed me to complete then the rest of the credits for the master's degree through the University of Pittsburgh's. We have an Institute for Clinical Research Education here.
Mhm.
And so I finished that during my fellowship time. Um, and it was a great experience. Again, very humbling, just There's a lot to learn,
Yeah,
but it was really wonderful, and those are some of the skills that I still need to use every day, and need to go back to, especially when, designing studies and thinking critically about things. It's a great thing. I knew, during my medical school years that that was just going to be necessary for me since I had never had that background, as an undergraduate, and would have had difficulty picking that up on my own.
yeah, yeah. And I mean, I can see just in the conversations that we have with some of the mid-career and late career
Mhm,
pancreatologists. I
mhm.
mean, I think Dr. Yadav gets a lot of respect for who he is and what he's done, but
Done
also
amazing
his
work.
his MPH and understanding of epidemiology. I imagine that he got through his master's degree, has like almost notoriety. Like everyone recognizes his skills in understanding
Mhm,
data and epidemiology. So I imagine picking some of those things up is really useful, and not just
mhm.
dabbling in them like a course or two, but kind of
Yeah,
finishing the whole curriculum.
yeah.
Um, the other, I guess, big question that I wanted to ask you about tonight was about your decision to pursue to like write for grants and do big
Mhm,
data, not big data, big science.
mhm,
Um, it sounds like you got involved pretty early on with the Doris Duke, which
mhm,
is like hugely competitive. It's
mhm,
really pushed you in the right direction towards
mhm.
that route. I guess, was there a point when you said, like, I'm going to start writing grants for whatever reason? Or kind of how'd you get to where you are today with that?
Yeah, no, I think that's a great question, because I think, that can be a big decision point for people, and something that some people decide that, isn't for them, which is perfectly fine, and is a really important thing, I think, to be, um honest with oneself about in terms of the time commitment and the energy required to do that and do it well. Um, I've had a lot of help along the way and a lot of encouragement and a lot of support. And so I think that's, a huge part of what has gotten me here. So I certainly don't want to downplay that. And so I think, looking around and seeing what kind of mentorship team and support that one might have for it as well is a really important part of making that decision along the way. I think for me, when I started considering what kind of career I wanted to have, there are those junction points in medical school here where, people kind of self-delineate along the lines of, well, how much procedure time would you like to have? What kind of mix of intellectual work do you do versus, kind of physical task work that requires muscle memory and so forth. Um, and I think I recognized that I wanted there to be a big intellectual component to the work that I was doing, not just, writing notes and talking with patients, which is hugely important and the backbone, of medical practice, but also that I wanted there to be an academic component to it. And I think a huge part of that then is applying for grant support, um, which allows me to protect some of my time for those kinds of activities in a way that I wouldn't be able to otherwise. Now, of course, it still delves a little bit into nights and weekends and time that I might not volunteer for it, but I think it's really it facilitates a lot of the other things that are required to pursue an academic career. It allows me the flexibility to do certain things. Travel to meetings and review data sets and review papers. And I wouldn't have that, I think, if the grant support from the NIH weren't there.
Yeah, yeah. And even in the few months that I've been faculty now, it's very easy to see that the clinical work just kind of creeps in on you, or just kind of the amount
Mhm,
creeps up. You get a couple new patients in clinic every week you're there.
mhm,
There's a lot of follow up for the endoscopy, and I
mhm,
think if you're, although you may start a career with good intentions, there's this kind of a clinical creep where everyone kind of drifts that way more and more just because it's demanding and starts taking the time.
yeah.
So I can definitely see how knowing that you want to do impactful big science,
Mhm,
you can kind of protect yourself a little bit if you're able to get those grants
mhm,
early on, perhaps,
mhm.
and enable you to do that.
Yeah, I mean, it's a stepwise fashion, I think, in my experience. Thinking about the kind of origin of interest in academic work. I remember, trying to write a senior thesis when I was in undergraduate, and oh man, was I bad at it. It took so much effort, and it really hit home, how much sustained effort that took. I mean, that wasn't just, hitting the books for one afternoon in the library, but to do it well, it was going to take really a lot of weeks, a lot of weeks.
Yeah,
And so that was just an interesting and again, pretty humbling experience where I maybe didn't do quite as well on that senior thesis as I would have liked, but it was very instrumental in teaching me about it. And in all honesty, parts of it were fun.
yeah,
And so I think, some of those early times being mentored in the Pancreas research group, there were similar moments where, sometimes you're very overwhelmed by the tasks in front of you and you just have to, line them up and take them one by one. And then you can have some fun with it. I think one of the tasks during my last year that I took on was that I agreed to author a book chapter, which, at the time was like, oh, that sounds like could be interesting. And it was really just quite a lot of work in a way that maybe naively I just hadn't expected. And then, when it came down to it, it was really very fun. Kind of the minutia of pulling in very carefully important references and trying to craft a message about this topic that I was assigned. And I think for those who might enjoy similar things, I think there's a lot of that in grant writing as well. And so I think it really just depends on what the mix is of things that you want to spend your time doing, and that can be a lot of different things. But those are some of the things that I've been fortunate to experience and had fun doing along the way.
yeah. That's one thing. Dr. Conwell, who was at Ohio State for a long time, would say a lot. Really? Was you really have to enjoy the process.
Mhm.
And I think grant writing, although sounds really daunting, it can be quite enjoyable. Trying to cleanly and clearly get your thoughts out onto a limited sheet of paper,
Mhm.
getting it to look just the right way. I mean, it's almost like doing a puzzle, I think.
Absolutely. Mhm.
But again, it's the kind of puzzle where if you can't see the photo on the box, you have no idea what it's supposed to look like. You don't really know how to
Yeah.
do it.
Yeah.
And having somebody mentor you through it, I think can allow you to enjoy the process more than
Mhm.
just like struggling. There's so many pages, there's so many rules. I can't figure out any of this.
Yeah.
Well, thanks for sharing your perspective on that
Of
too.
course.
One of the questions that we got at our session last month was about what does a day in the life look like for a gastroenterologist or a pancreatologist? And you mentioned that you've been able to kind of earn some dedicated research time.
Mhm.
But do you mind just giving us like an overview of your week? How much of that is clinical? How much of that is research?
Yeah,
Um,
absolutely. Mm. Maybe I can actually just revisit the last question briefly
yeah,
about grants, just to mention that um, grant writing can also be very much an iterative process and something that is very gradual in its successes, and there are a lot of setbacks. And so I guess I would just also encourage people to keep trying. I think even though I've been very lucky to have some successes along the way, I can count just as many failures and some big ones too, where I was unsuccessful actually in repeated attempts
yeah.
to apply for a K award. And so, it was just the particularities of certain things and the way that certain forces went those years. And so, I think I just, it gave me a lot of perspective actually on uh, the utility of just kind of picking things up and trying again when other opportunities present themselves. And so, for those that are interested, I think there's always a way, even if it might come in sort of unexpected ways.
Yeah, and the first grant that I submitted was rejected, and it had a super high funding rate. And I was like,
Oh,
this is surefire. I mean, 1 in 5 people get this. Of course, I'll be, one of the 20%, and I was not. And it really is a sort of a gut check. It makes you think like, man, I thought this was the greatest project that ever came to light, and it really makes you think twice about like, oh boy, was I on the right page with this? Did I not say it right? And I think it refined my thinking about the topic.
Well, certainly those things can be they can be instructive, and getting additional feedback at that point on what things could improve the idea, that can sometimes help in terms of reapplying with a similar idea. But it's all, it is an iterative process that can at times be quite humbling. But I think again, there are opportunities for good work to be done. And as I mentioned at the very beginning, I mean, this is a field that's hugely open for progress. So I think people are very hungry for that.
Yeah. Before we get into
Yeah,
the daily life as a gastroenterologist, Arjun had a question in the chat
sure.
about pilot data, particularly in the field of medical pancreatology, where it's such a new
Mhm.
field. It can be hard to have case series, or it can be hard to have enough to really support a grant.
Mhm.
Can you share a little bit about kind of how you generated pilot data for your R?
Mhm. Um, oh man, it was not elegant. A lot of a lot of donated time, a lot of yeah, a lot of energy. But I think it's what we were talking about earlier, where this was a project that really interested me, and I was committed to see how it was going to turn out. Um, and so let's see. I guess there's a short answer and there's a long answer. I think one of the short answer is about pilot data and so forth. There are some grant opportunities that don't require pilot data. The truth is, though, is that everyone would love to see what progress you've made on that project so far. If it's a project worth doing, you'll find a way to do it, whether you get that funding or not. And so to encourage someone to grant you that funding, it's often helpful to show that progress, to show your commitment to it, and show that the idea is feasible. Everyone loves to see that. And so it's not that it's falsely advertised that the pilot data isn't necessary. It's just that people love to see progress that's being made and energy putting into a progress that holds a project that holds promise. And so, looking at the specifics, I think, of different opportunities is really helpful. There are definitely grants out there for pilot projects. And so, paying attention to those opportunities, and then also getting feedback from mentors ahead of time who can help to shape a project into its best possible form for application, I think can be really instructive. In the past, sometimes I've also reached out to the architects of the grant itself. It's not always an it's not always a helpful process, but oftentimes a conversation, brief and oral, or a conversation over the telephone or in person, can give you some sense of what that grant opportunity is really looking for. Who it is that they are trying to encourage to apply, and those kinds of things, I think, can help you shape collaborations or help to shape a project to, again, make it the most appropriate for application. Um, I think also, again, looking at some of the things that might have been funded by similar opportunities in the past can be additionally very instructive, in the sense of, well, there's this award that funds 3 opportunities per year. 2 of them go to basic science and 1 of them goes to a clinical project. How likely is it that my project is to get funded? The critical piece of information might be, well, are there 5 applications or 50 applications that go in? And so learning a little bit about that beforehand and paying attention to some of those details can be some extra legwork on the front end, but can really pay off, I think, to provide some opportunities for you. And so, with that, I guess what I would say is that there are some organizations that have been really interested in funding new investigators. Among those, the National Pancreas Foundation and the American Pancreatic Association, which have been huge.
Mhm.
And so I am forever indebted to the American Pancreatic Association for having kindly funded a pilot grant that I applied for in 2018. And that actually gave me enough funding to be able to pay participants in what was then our pilot trial, which provided the pilot data for application for R01 funding.
Mhm.
And so, I mean, we're talking a small sum, but a small sum that made all the difference to me. You know, it provided for, support for different people on our grant and on the effort. It provided something like $25 per patient, I think. But $25 is enough to encourage a healthy control who has a free hour to come in and fill out some questionnaires and do some initial testing. And so that was huge. So I spent several months back to back, 6 to 8 hours a day, running people through this testing protocol. And I enrolled 145 patients at our site, within a year. And that gave us the pilot data that we needed to be able to establish normal levels in this new testing protocol and move forward from there. So I won't bore you with all the details, but that's a long-winded way of saying that there are lots of avenues to potential success. But I think some of those initial opportunities can be best had with a little bit of legwork on the front end.
Yeah. I'll share my perspective
Yeah,
on this
please
one
do.
too. So one of probably my greatest interest in pancreatology was from a poster I saw at the APA conference in like 2018, 2019, out of the Hopkins group, looking at CFTR modulators on pancreatitis in adults with CF. And to that point, there was really no mechanistic treatment of acute pancreatitis, and really wasn't one on the horizon either. And they showed this like dramatic curve that was like patients were having pancreatitis every 6 months, started this drug, and then nothing. And I just thought, like, so mind blowing. I knew like I wanted to do that. Now, the challenge is in getting those for patients without cystic fibrosis, that they're super expensive. And so that you have to have like massive funding in order to do it as part of a trial. So what I've been doing for the last couple of years is try to better understand like what patients with cystic fibrosis really benefit from these drugs, in order to, in my mind, generate pilot data that could then justify extrapolating those to the next group of patients who are similar, and then the next group of patients who are similar. What we were able to do is to clarify some of that with a systematic review. We looked at a big data project using MarketScan. And neither of those were necessarily game-changing science, and they weren't doing a randomized control trial of pilot data. But I got 2 first author publications on the field of pancreatitis, CF, CFTR modulators, which I do think kind of rounding out that aspect of your biosketch is also part of sort of preparing your first successful grant. Some of it's some pilot data, some of it is, look, I'm engaged in this field, I'm interested, been working on it for years, I'm the one to do this. And I think kind of filling out your biosketch in a certain way helps with that too. Like Anna said, I've had this idea since 2019, and I still feel like I'm maybe halfway there. And so developing the pilot data is not a overnight project. But I think if you have a really like a pet project, or something that you're just so you get your teeth into it, it really will give you a lot of fuel to see it through. It's just a matter of picking up some other support along the way. Maybe it's the barriers, I can't get patients to enroll. Okay, maybe a small pilot grant at your institution will pay for those $25 healthy controls to come in and stick their hand in a bucket of ice water. Things like that. So I think with passion and a little creativity, you may find other ways to generate your pilot data. If you're a bench researcher, I mean, you probably need mice and you need a lab, and there are costs to get it. And I don't know where that money comes from. But from the clinical side, there's probably more creative ways to generate something that looks like pilot data.
Thank you for taking your time to organize this and answering my question.
Of course. And best of luck with generating your pilot.
I'm just a second year resident right now at the Cleveland Clinic, so I will go a long way, I guess.
Never too early to start.
That's good. I tell you, one of the most impressive stories I heard was Darwin Conwell, who's my previous mentor, now he's in Kentucky. He had a fellow that had worked in a lab when he was a medical student. And he had this hypothesis about lactated ringers versus normal saline, and just kind of filed this away and like kind of always wanted to work on it. Did a residency, did a fellowship. And as soon as he started fellowship, he's like, finally, I can work on this project. And did a randomized control trial of LR versus normal saline in acute pancreatitis. And it's one of the randomized studies in the field that's really shaped our practice, how we treat, I don't know, how many millions of patients per year with acute pancreatitis. And so, I mean, he had an idea, brought him through all these stages of training, and then he found a mentor who could help him carry it over the line. So I think when you get one of these big projects, it's great to work on it, but also to talk to some other more senior people and say, like, how do I actually bring this to fruition? What are the resources required, and kind of help me get there?
Yeah, it's great.
We have maybe another 10 minutes. Anna, if you want to, I guess, talk with us just a little bit about kind of day in the life of a gastroenterologist in terms of procedures, clinic. You mentioned there's pancreas is a cerebral space. So how much of your day do you just, spend writing books and thinking?
Yeah. No, that's a great question. And I guess what I would start by saying is that every day is different. So in normal time as a medical pancreatologist, where I spend roughly 50% of my time doing clinical things and then roughly 50% research, I'll just run through the schedule for the week. So Monday, endoscopy day, 7:15 start, wheels in. You've got 8 to 10 cases, got to be done by 2:30 because the anesthesia goes home. And so then 2:30 to 5 is, oh man, you got to catch up on all the weekend emails and things that people, they send them out quickly on Monday morning. And so, there's a lot of responses to the Office of Research and your research team. Maybe there are some patients that had questions, those need to be answered and so forth. And so Monday is kind of catch up time to get all of that done and get everything set for the week. Tuesday for me is a research day. And so 7:30 in the morning might be a meeting with other colleague researchers in the pancreas group, or it might be journal club for the fellows between 7:30 and 8:30, or maybe it's a quiet hour during 7:30 to 8:30. Then 8:30 to 10 is kind of some quiet time. Then there are several research meetings with our group, which includes lab manager, laboratory techs, research coordinators, and research manager, talk about all the different projects and what's going on, get updates, troubleshoot, etc. And then individual meetings throughout the rest of the day with statisticians, other researchers. If there's a little bit of time, a 90-minute break or something in there, then maybe I'll do some writing or editing of things that come through. Wednesday's pancreas clinic at our institution. Ironically, I'm not part of that day, but I, as a junior faculty member, I attend because that's when many of the patients will come in. And so you're really, ready at a moment's notice to enroll patients to one of at least a dozen different study protocols that are ongoing here. So you're ready to do sensory testing, you're ready to draw blood, you're ready to teach a research coordinator how to do, any of those things, might be calling patients, etc. Thursday is clinic day, and so it starts at 7 actually with an interdisciplinary meeting. Our ERCP group, which includes therapeutic endoscopists and medical pancreatologists, and then nurses for both, meets to talk about all different kinds of cases. So we have a case conference on Thursday morning where we just talk about difficult pancreas cases, severe necrotizing pancreatitis, recurrent acute pancreatitis, chronic pain, all kinds of different things. 8 to 4 is clinic. 4 after that is sort of catch-up time. I forgot to mention on Wednesday that there are a couple of other interdisciplinary meetings. There's Pancreas Tumor Board, there's grand rounds in the afternoon, and then there may be other conferences for, consortium meetings and so forth that are going on during those times. Friday morning, once a month from 7 to 8 is PB Live, which is a conference that, is also a consortium group that many of you guys might know about or attend. So that's an educational conference. There's also an EUS conference at our institution that happens on other weeks. Then there's a couple of hours of various research related things. There's a research rounds that happen between 12 to 1 on our Fridays. And then in the afternoon on Friday, it's trying to catch up on everything else from the week. Again, contacting patients, trying to, review case report forms, get data entry done. And in the meantime, have phone calls and so forth to touch base on various things. I'll be honest, on some weekends as well, I might be doing various things, especially if I'm on call or on service and here in the hospital. I will take some times to, enroll patients or collect samples, try and help out the lab techs and so forth to deliver those if I can, or catch up on a couple of things, just kind of loose ends, if I can, while I'm here after rounding. Service weeks wise, my commitments, and this looks different institution to institution, but at the current time, I do 5 weeks of GI here, inpatient GI, and then 5 weeks of pancreatobiliary. I also previously had worked on our TPN service inpatient, which was a really, great opportunity. This year, I'm not doing that, but, I'm open to it again in the future.
I have to say, it sounds like in some ways a typical gastroenterologist schedule, because you always have to be the blessing of gastroenterology is that there's a lot of variety in the day.
Yeah.
The curse is that oftentimes you have to do 2 at the same time.
Yes.
So
That's true.
while, for example, even during your procedure day, there's probably a sense of, there's 10 minutes between cases. Let me catch up on a couple of emails, and then you're still writing the email in your mind while you're working your way back from the CECM.
Absolutely.
And so I do think that it's definitely a blessing and a curse, but a hallmark of gastroenterology across the board is just that blend of some procedures, some clinic, and some either research or educational activities. I read a book this summer that Phil Hart recommended that I go through, and it was called Deep Work by Cal Newport. Have you heard of that, or have you ever read that book? Apparently it's very polarizing. I mentioned it to my sister, who's working on a PhD, and she did not like it, but Phil likes it and I like it. And it's this concept that we do our best work when we are free from distraction, and when we can schedule that in these 90-minute to up to 3-hour blocks of time. Do you feel that are there ever times when you have these just big blocks where you can do your research, or do you feel that that's interrupted by meetings or clinical work or other things like that?
It's very rare that I would have a big block of time. And so I think what I've, done on my more productive days is just learn to harness small moments for focused tasks. And that remains, a very difficult thing to do. But I think as one goes, in my experience so far, short as it may have been, it's just important to continue to reevaluate priorities. What email needs to get sent right now? What patient needs to be responded to right now? You'd love to be able to do them in the order they come in your inbox, to be able to close them down very nicely, but oftentimes that doesn't result in the important ones getting done. And so that can be a very hard task. And I still struggle with that for sure. But I think learning how to do that and perfecting that day after day really helps. And that's really the only way that I've learned to be able to get some of those important tasks done. When it comes down to it, the things that allow me to continue doing my work here, the funding does allow me to have protected time. It's very important actually to finalize enough tasks to be able to get that grant in by its deadline. It doesn't count if it doesn't meet the deadline. And so learning how to do that and prioritize that is really important. Similarly, for manuscript submissions, it doesn't count unless you pull it across the finish line. And so learning how to do that as a priority is really important. Patients are also very important. And so I think it's important to be humanistic in that way. But it's also important to set boundaries in terms of how much time you're able to allot to a problem, and be realistic about the commitments that you have on that front. So yeah, I'm very grateful, I think, for the opportunity to do the mix of things that I do and try to be realistic about what commitments I can really honor.
Yeah, yeah. Well, all that sounds really great, and I think that hopefully gives people a sense of a day in the life of a academic medical pancreatologist, which hopefully we have more and more people coming
Oh,
up
I hope
the
so
training
too.
pipeline.
We need more good people just like you, Mitch.
Well, thank you, thank you. It's funny that Phil has on his bio sketch somewhere in there, like, I am one of a handful of gastroenterologists who have completed a medical pancreatology fellowship, and it is a small group, and I think that we offer something unique in the field. So it's always nice to connect with somebody else who kind of has that same perspective.
Absolutely. I think it's a growing field and one that will, continue to offer a lot of opportunities. And so
Yeah.
it's an exciting time to be here.
Yeah, and but thank you so much for your time.
Oh, again,
After a full day of clinic, I've had you talking for an hour nonstop. But thank you so much for sharing your perspective and your experience with us.
well, again, I'm so honored to have been asked. Thank you so much, and thank you for having me. Thank you to all of you for joining this evening for the conversation. And so, if you have any questions, of course, please feel free to reach out. Here at the University of Pittsburgh, we're always, we're always looking for people and so forth. So, would be happy to answer questions at any point.
That's great. So anyone else, feel free to ask a question. Otherwise, I'm going to ask you one, Anna, that's
Oh, sure.
unrelated to the topic. I had someone reach out at the end of our last meeting,
Mhm.
and I've actually had another person reach out since about medical pancreatology fellowship
Mhm.
before gastroenterology. One of them was somebody who had completed a GI fellowship abroad
Mhm.
and hadn't done any GI training here, but wanted to do
Mhm.
medical pancreatology.
Mhm.
The other was a resident who sometime in the past couple of years did not successfully match into GI, and they wondered about medical pancreatology as sort of a not quite a gap year, but a way
Mhm.
to spread their time, I guess, away from doing hospital medicine.
Mhm.
Is that something you guys do at Pittsburgh, or are your medical pancreatologists, i.e., you, have to be after GI fellowship?
I think it's a great question, and what I would say is that each interested individual is evaluated, on the
And where
merit
this,
of their individual situation. I think we've had interested applicants come from lots of different avenues, and so I think there is no strict, set of requirements that I'm aware of with regard to prior GI fellowship and so forth.
yeah,
But I think it's important, to have someone who's going to mix well with the institution and the aims of the fellowship and so forth. And so, I think, yeah, it's great to hear that people are interested in reaching out. And I think right now, one of the luxuries of the field is that we're not bound actually by certain entrance requirements. And so I think if there's a real interest there, there can be, there are opportunities to be had.
okay, that's great to know. So hopefully we'll put that in the recording. So if folks are interested in medical pancreatology prior to doing a GI fellowship, there are certainly opportunities. I feel, and I've been telling folks, I think they do that at Hopkins. I think they've had a couple of kind of non-gastroenterologists who have done pancreatology fellowships, whether it's more of a research fellow type thing, or if they do have some clinical work. I'm not totally sure what that looks like.
I'm not sure. And each institution, I think at this point, handles the situation a little bit
Yeah,
differently. And so again, I think that's the luxury is that it's very much, an individual opportunity. And so, yeah, I think it would just depend on the situation,
yeah.
exactly what that person might be interested in.
Yeah. So Awesome. Thanks so much
Yeah.
for answering that. That's a weird one that I don't know the answer to that one. So
Oh, no, I think again, it's a growing field and we're expanding in all kinds of ways. So I think like I said, there are opportunities to be had.
yeah, awesome. Well,
Yeah. Well, again, it was great talking with you and thank you again so much for having me. I just am very honored and yeah, it's been wonderful. Thank you.
yep, it's great having you. Thanks again, Anna.